Hi, this is Tara Scott, and I recently gave this talk in Florida and Naples for the Foundation Women's Luncheon, and I know people weren't able to be there, so it was suggested to me by the foundation staff that I record this, and whoops, hold on a second, and that way more people can watch it. So I'm happy to talk to you today about integrative and functional medicine and what exciting things Summa has in the future. So this is a picture of me in circa 1995. I was the actual poster child for the OB residency when I did my residency at Summa Health. I had a pretty traditional start to my career. I did the 6-year program through NeoMed, so in 6 years was done with college and medical school. I did a 5-year residency, 1 year of a transitional year, and a 4 at Akron City at the time, or Summa now, in OBGYN, and worked for a very busy OBGYN practice. And so everybody who goes into to functional medicine usually has a story and a reason and something personal that changes their focus. So this is a picture of me with my family. Yes, perms were very in at that time. This is my older sister. This is my younger sister. This is me. And this is my brother. And we all, you can see, were a little on the heavy side, not super healthy. We were raised with very, poor food ideas as far as food was a reward for us. And so we all kind of have our own medical struggles, but the biggest one happened about 10 years ago when my brother suddenly died of a heart attack. Now, he was a diabetic, he was a smoker, he was a lawyer, he was stressed, he was on a statin, so he had a lot of risk factors. But to traditional medicine, he was healthy. He'd been to the doctor, and he was healthy up until the day he died. So at that point, that really changed the way I looked at medicine. I thought, there has to be something that we can detect disease previous to this. And even though he was healthy to traditional standards, he had a lot of red flags in his health, a lot of risk factors. But to the average doctor, since he was only 38 years old and had not had any problems yet, he was healthy. So I started doing more learning about functional medicine. I first became a menopause practitioner because I started to really look at women's hormone issues, and I had my own struggles with infertility. So that was a natural segue for me to do mostly women's health at first. And then I did a fellowship through the A4M, the American Academy of Anti-Aging Medicine, where I learned about functional medicine. This broadened my horizon to learn about stress-related disorders, to also learn about thyroid disorders and gastrointestinal, cardiovascular, everything really that we were looking at with a functional medicine perspective. And then I also got another board certification in integrative medicine, which I'll explain to you the difference between those two things. I got a job through LP3 Network about 7 years ago, where I actually teach a course and teach other doctors, pharmacists, nurse practitioners, how to treat people with hormone disorders from a functional or integrative perspective. So this is my cartoon of modern medicine today. Hagar says, "What's wrong with me, doc? You eat too much, you drink too much, you're short of breath, you don't get enough sleep, you don't exercise, you have bad knees and a bad back, you need glasses, your hearing is bad, you have a sinus condition, your hair is dirty and oily, and you have dandruff." So what does Hagar say? Is there a pill I can take for that? Now, unfortunately, this is still the mentality of many people today, that they have a problem and they want a prescription. But it's also, on the other side, the mentality of the provider, that the patient comes in and they only have 7 minutes to figure out what's wrong with that patient. So you can't get too in-depth with the history, and you have to decide what's wrong with the patient in that 7 minutes and what prescription am I going to write so the patient can take something and I can feel like I've done something. So what exactly is functional medicine? Well, functional medicine, let's first talk about conventional medicine or traditional medicine. So traditional medicine is disease-oriented, which means if you come in with a set of symptoms, I can't tell you what you have until you have a diagnosis and you have that disease. It's doctor-centered, meaning you come in and I tell you what to do. Everyone is treated the same. So once you have the diagnosis of thyroid disorder, everyone gets the same treatment. It's specialized in the sense that if you were seeing me for your diabetes and you started having headaches, I'd have to send you to a neurologist. And then if you went to see the neurologist and you were having joint aches, then you'd have to see a rheumatologist. So it's very siloed now and very specialized. And the diagnosis is based on symptoms, whereas functional medicine is health-oriented. You don't feel silly for going to a functional medicine doctor that when you're healthy. That's the whole goal, is to keep people out of the ER, keep people out of the hospital. It's very patient-centered. So it's a partnership between the doctor and you. I mean, gone are the days of doctor dictator where you come, I tell you what to do, and that's it. It's a discussion. We see what are your health goals? What therapies and lifestyle modifications fit with you, with your life? We like to look at the underlying cause instead of just treating a symptom, and that requires us to look at your biochemical individuality and take a preventative approach. It can be explained a little bit better with this functional medicine tree. So we see the outside, the leaves. We might see that you have a problem like diabetes or heart disease, and that's what traditional medicine looks like, is the outside and the leaves. But at functional medicine, we might say, why do you have diabetes? Do you have any hormonal imbalances with cortisol? Do you have inflammation that's causing your sugar to be abnormal? Maybe it's a problem with your immune system or your digestion. So we look back at the root of the problem and then try to heal that, and then it would fix the leaves. This is a better illustration as well, is what we see on the top is just these diseases, heart disease, autoimmunity, obesity, but there are always underlying causes. And if we get to the underlying causes, we can prevent these from being more of a problem. So what is integrative medicine then? Well, I see integrative medicine as a broader scope, and under the hood of integrative medicine would be different types of medicine like osteopathic medicine, naturopathic medicine, and functional medicine. But it also is a wider net that would include other treatment modalities such as massage, physical therapy, chiropractic care, Ayurveda, Chinese medicine. So they're all under the hood, and that would be Eastern medicine and Western medicine. And those would all be integrative medicine. So our goal is to build a community of health in Akron. So I have been partnering over the last year and a half with other providers in the area. We've started a group that we meet quarterly, and that includes dietitians, physical therapists, naturopaths, compounding pharmacists, acupuncturists, chiropractors, and we meet and we collaborate and we network, and we also have some education. So it's our goal to get everyone well. So if I see a patient maybe that has a problem with heavy metal toxicity, that isn't something that I do a lot. Now I know I can refer to another provider. So that way we can get the proper care for the proper patient. So the problem is this current healthcare model. Right now, researchers have said that we spend about $1 trillion annually, and that translates to about 75% of healthcare dollars spent for chronic disease. And so they actually just study that said that if you invest $10 per person, and all you do is talk about physical inactivity, poor nutrition, and smoking, you could actually yield a return of 5.6 for every dollar spent, so that your investment's $10, so you would get 10 times $5, which is $50. That's your investment just by talking about physical inactivity, poor nutrition, and smoking. So the current situation really is a problem because the spending in the U.S. is really unsustainable. The average healthcare spend for a developed nation is about $3,000, but we spend about $15,000 per person in the U.S., yet the life expectancy is only the 50th on that scale. It doesn't even get us into the top 10. Type 2 diabetes alone is a luminal global pandemic, and of course this is an area that is very near and dear to my heart because of my brother. The good news is, though, is that 80% of all healthcare spending in the U.S. is tied to treatment of conditions rooting in poor lifestyle choices. So that means the chronic conditions such as high blood pressure, heart disease, stroke, diabetes, obesity, osteoporosis, and some types of cancer actually are the most costly and preventable types of all health conditions. So there was a publication in 1993 called Actual Causes of Death in the U.S. And what they found is that premature deaths, 80% of them were attributed to three things: what you do with your feet, what you do with your forks, and what you do with your fingers. So feet is how much you walk, how sedentary you are. Unfortunately, we've turned into a very sedentary nation. Remember when we were younger? I mean, if you were doing your homework, you'd go to the library, you'd have to walk to the card catalog, you'd have to go get the book out. Now my kids have everything at their fingertips at their laptops, so they don't need to walk or anywhere when they're doing homework or to go anywhere. And I walk to school. So we as a society are much more sedentary, and you have to be intentional about what you do with your feet and getting your steps in. The next thing is forks. What do you do with your fork? You are the only person that can control what goes in your mouth. Nobody can force you to eat or not eat something. So you have the power to be mindful about what kind of food you're eating. And so that would be something like eating pure food that occurs in nature. If you can hunt it, pick it, or grow it, then it's something that's safe that you could eat generally. I like to call it the naked diet. So that's not to say that you eat naked. It's just that food is in its original form. And most people do okay with that. And it's just a simple matter of educating people also not to smoke, and that's the fingers. I think we're doing a lot better in this because we have a lot of non-smoking zones. The hospital's gone to a no-smoking policy. So I think that is not as much of an issue as it was in the past, but there still are people who are choosing to smoke. So our therapies in functional and integrative medicine include things like lifestyle modification, dietary education, stress management. We do use medications when we need to, and we use nutraceuticals, which is a supplement, targeted supplement, and recommending exercise. But these are things that put the onus on the patient. The patient has to be an active participant in the care. And so I find that a lot of patients are really receptive to this. They just really don't know where to start. So they need someone like a health coach. We have a health coach at our office that can be with you to help you with your dietary choices and exercise as well. The types of testing we do in functional medicine include regular traditional testing for some things, but we also do saliva testing for cortisol, for hormone levels, urine testing for a lot of things, and also stool testing as well. So it really just depends what we're trying to learn about your biochemical individuality. So the one thing that I think has the biggest link to a lot of these chronic diseases is cortisol. Cortisol is a stress hormone, and it is made in your adrenal gland, and it responds to stress, but it does have its own circadian rhythm, and that's such that in the morning you wake up and the cortisol is the highest, and then you go about your day, and cortisol then gently goes down in the night, and you feel tired. But what we have today is we have artificial light, we have people staying up later, so this rhythm gets disrupted. Now, if you think about it, cortisol is a response to stress. So usually you have one of two phases. You have a fight or flight, which is your adrenaline rush, and you have a rest and digest. So when you're a caveman and you're hunting for food, you saw a bear. And at that time, you either died or you lived. So you'd have a adrenaline rush, you'd be in fight or flight, you'd run with superhuman strength back to your cave. But you didn't go back to your cave at that time and think, what am I going to do about hunting for food? What if that bear comes back? How am I going to protect my family? Should I install a security system? No, you just had life or death stress, and then you had followed by a period of rest and restoration. You slept 12 hours a night because there was no electricity. You were constantly exercising and moving. You weren't sedentary. And you're eating that trendy paleo diet. So there was a lot less disease back then. So now with cortisol being disrupted by our 24/7 go, 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 with us not having that rest and digest important time and having a chronic undulating stress, we have a lot of disruptions in cortisol. So first, usually your cortisol goes up. You may present with anxiety, nervousness, decreased concentration, water retention, heart palpitations, hypoglycemia. Sleep disturbance is the most common one, but I also hear a lot of people complain of weight gain, especially at the waist. After a while, cortisol isn't able to stay high. So eventually then cortisol drops and is lower. So you might find yourself being apathetic or feel burned out, have less stamina, some muscle loss. Fatigue is a big complaint. Sometimes joint pains and muscle pain. Could be lower blood pressure and some salt craving. So the typical energy pattern for a person who has adrenal issues is in the morning, they can barely get out of bed. It is the worst time of day. Now, if they had the luxury to sleep in, they'd feel better by 9 a.m., but most of us who work have to get up earlier. So from 7 to 9 is the worst time of the day. And then what do? We chug coffee to get through our day. And once we have our coffee and get going, mid-morning, most people are pretty productive. And then we eat lunch. Now, depending on what we eat lunch, it depends on how we feel. But after lunch, we usually have this 3 o'clock rut. And you're reaching for that second cup of coffee, or maybe you're reaching for the sugar, a handful of Skittles, some chocolate, anything that's a carb to give you energy to get through your day. And then somehow people find their way getting through the day. And especially if you're a working mom, you start your second job when you get home, which is cooking, cleaning, running kids around, taking care of the family. But somehow people generally feel better in the evening. So you may feel like getting to sleep, but you've got so much to do that you're tired but wired. And when you finally do lie down to go to sleep, you might look like this lady here. She can't go to sleep. She's thinking about packing lunches, everything she has to do, how's she going to get the carpool done. So clearly, those energy patterns suggest a cortisol dysfunction. Now, the only way for us to test it is in the saliva. But the good news is treatment is usually lifestyle changes, diet, and supplements. So this is one of those things where knowledge is power. Just knowing how your cortisol is can help you make the changes that you didn't know you should make for your health. So we usually get an adrenal saliva test that looks something like this, that will measure your cortisol 4 times throughout the day, and it's usually in the morning, within an hour of waking, before lunch, before dinner, and at bedtime. High cortisol also affects your insulin, and so that's one way it can make you gain weight, but it also can oppose your neurotransmitter serotonin. So a lot of people might present with anxiety or depression and get put on a depression med when it's just cortisol that's the problem. So how do we treat cortisol? Well, some of the treatments are very easy and some even free. Meditation and yoga is one way that's been fantastic to protect your body from the effects of cortisol. And there are plenty of great apps out there, or courses you can take, or books you can read about how to meditate. This is something called heart math. That is a pretty simple thing. We put a little probe on your earlobe, and it measures your heart rate, and it sort of gives you feedback to see that you might not even feel that you're anxious, but it measures your heart rate variability. And then this way you can get clues to, okay, if I take a couple deep breaths, look how my heart rate settles down. Acupuncture is really great for stress. There's a protocol for stress and to get you out of that fight or flight mode. And then certainly lavender essential oil is fantastic. You can put some on the bottom of your feet to help you sleep. You can rub it on the palms of your hand and take an inhale, and instantly that lavender will go straight up your nostrils to your brain and your olfactory or smell center, and it will work instantly on that fight or flight to get you to calm down and slow your respiration, your breathing, and your heart rate. This is really important. This was a study published a couple years ago, and it showed that healthy lifestyle can prevent 40% of cancers and 50% of cancer deaths in the United States. So they looked at 4 health habits: 150 minutes of moderate intensity exercise per week, maintaining your BMI between 18 and 27.5. And now 27.5 is overweight, so it's not even in the normal weight. The third habit is not smoking, and the fourth was drinking in moderation, which is 1 drink for women and 2 for men. And these 4 habits were associated with the prevention of lung, colon, breast, pancreatic, and kidney cancer. And some of those cancers are killers. So why are we not broadcasting this to everyone, that you could prevent 40% of cancer cases and 50% of cancer deaths just by these 4 health habits? I'm not sure why people don't know that. So what are the areas at Summa that we're really interested in expanding in our integrative medicine department? Well, the first thing is the orthopedic department. They're very interested in alternative for pain medicine, especially with the opioid crisis that we have going on in Ohio and across the United States. They're really looking for pre-op and post-op pain alternatives. And we are going to start with acupuncture for some of the indications like chronic low back pain or post-op from orthopedic surgeons. Surgery. So that's going to be great. Now, the oncology department has always been sort of integrative, and they've been already offering services such as Reiki, massage, essential oils, and I don't know if they've been offering acupuncture, but they've always given alternatives to ease the journey of the cancer patient. It may not make a difference in survival rates, or it may. Certainly, I can say that by working on cortisol, there have been studies that have been published that when you have a low cortisol curve after cancer treatments, you have a poor prognosis. So if you're getting treatments that are helping cortisol, like massage and acupuncture, that, by proxy would help your survival. And the third area at Summa is really women's health. And mostly because of my background, and that's where more of my practice is to provide integrative care for women spanning all ages, from teens with acne that want holistic therapy, women in their 20s and 30s that are having painful periods or issues, and women in their 40s and 50s with menopausal issues. So there's a lot of things we can do from an integrative standpoint. The first thing that we're going to do at Summa, and hopefully second quarter, is roll out acupuncture. And studies have shown a decrease in post-op pain. And acupuncture done in the military not only improved morale and mood, but decreased stress and illness, and there were less days of missed work. So we're getting ready to get this offered probably in Hudson first, but hopefully in Fairlawn and other areas after. So that will be the first thing we'll concentrate on launching. The next thing we're doing is creating a multidisciplinary pelvic health center, and that will involve not only gynecology and urology, but a functional medicine evaluation for your hormones and your gut, acupuncture, mental health, pelvic floor therapist, physical therapist, pelvic chiropractor, and other alternative therapies for women of any age that are having chronic pelvic pain that have already had traditional therapies and traditional workup, or somebody who has. So that's one thing we're working on getting launched later this year as well. I always close every talk that I do by talking about this. I think I just gave it away. This radical new medical therapy. This is Dr. Semmelweis, and he was an OBGYN physician in around 1847. And he had this radical new therapy, and he was able to decrease the death rate due to infections from 35% down to below 1%. And he made such an impression that at a neighboring hospital they asked him to talk, but he could not explain his scientific findings. So he was actually ridiculed. He was committed to an insane asylum, and he was beaten to death 2 weeks after that. And I'm sure you can't guess what that radical new medical therapy was, or maybe you can. And it was hand washing. He suggested hand washing with chlorinated lime solutions. He and his residents would go do autopsies, and they deliver a baby, then they do circumcisions, then they go on postpartum rounds, and in between seeing all these patients, they used a lime solution to wash their hands. But at that time, bacteria had not been developed yet. So because he couldn't say why it worked, he was rejected. So a lot of things we do in functional and integrative medicine, we know that it works. We may not have the explanation why, but our goal is to make the patient better. So even if it only works for one person, I think in my mind, it's got to be helpful. So I think that's why I like a lot of these therapies. If you're interested in more information about integrative medicine, you can always follow my practice on Facebook. It's Revitalize Med, and Instagram, Revitalize Med, and also Twitter. I'm always trying to make short videos of education and retweet articles that I think are important for health. And also, we are going to be having a movie night in Akron on February 28th, and accompanied with this video will be a flyer. So I'm hoping that you guys are all getting really excited about integrative medicine like I am. So I think that there's a lot that Summa can do, and I'm really excited to be part of it.